Today we are going to talk about proper body mechanics for lifting. You're going to want to widen your feet to increase the base of your support and improve your balance. You want to move close to the object and make sure you can safely lift the object without any assistance. And you want to tighten your core and do not twist your back and lift simultaneously. And now we're going to show you a few techniques for lifting to keep yourself safe as a PT.
Gowns were not worn in the filming of this instructional video in the attempt to effectively display proper body mechanics. The extra material of the gown would have restricted important visual cues of the demonstrations. Because of this, 6 feet of distancing was always maintained. Please stay safe.
Go ahead. A deep squat is performed to position the hips below the level of the knees. The lifter's feet straddle the object with the upper extremities parallel to each other. The lifter grasps the opposite sides, the handles or the underside of the object, and the lifter's trunk is maintained in a vertical position, and the lumbar spine remains in lordosis with an anterior pelvic tilt.
In a straight leg lift, the lifter's knees are only slightly flexed or may be fully extended. The lower extremities either are parallel to each other or straddle the object, and the upper extremities are either parallel to each other or grasp the opposite sides of the object. The trunk may be positioned either vertically or horizontally, and the lumbar spine remains in lordosis.
The one-leg stance lift can be used for light objects that can be lifted easily with one upper extremity. The lifter faces the object with the body weight shifted onto the forward lower extremity. To pick up the object, the weight-bearing lower extremity is partially flexed at the hip and knee, while the non-weight-bearing lower extremity is extended to counterbalance the forward movement of the trunk. The lifter picks up the object in a manner similar to the way a golfer removes a golf ball from the cup and returns to an upright position.
For the half kneeling lift, the lifter aligns the body by kneeling on one knee, positioned behind and one side of the object, and the opposite leg to one side of the object with the foot flat and hip and knee flexed. The lifter grasps the object and places the object on the thigh of the flexed lower extremity. This secures the object close to the body before standing. The lifter then begins to rise to stand. This technique should not be used if the lifter has knee problems that prevent kneeling.
The value of proper body mechanics is to conserve energy, reduce stress and strain on muscles, joints, soft tissue, and ligaments, promote safe and effective movements, maintain proper body control and balance, and promote effective cardiopulmonary function.
That's all, folks.